Hi, good evening.
Hi, good evening. Happy weekend.
Happy weekend. My name is Kaylee. How can I call you?
You can call me Tay.
Okay. Hi there, Mr. Tay. How are you doing today?
I'm good. How about you?
Well, I'm fine. I'm still working because we
Yeah,
are at home.
yes,
Yes.
right. Yeah. So is
How
your
about you?
class full booked?
hmm not really, I think. Yeah.
Yeah,
I think I'm not really fully booked, but it's okay.
yeah.
You
Almost
know.
full booked, right?
Maybe. Yeah, I think.
Mm,
I hope.
yeah.
I hope I
Because
can be
you
fully
are a
booked today.
very popular teacher. I know that.
Ah, really? I think
Yeah.
not.
You are.
I
Oh,
think our
yeah,
teacher is more popular, right?
yeah. Right.
Yes. Okay. So, Mr. Tay, because it's our first time to meet, maybe you have questions for me. Anything that you want to ask?
Um, Anything about you?
Yeah. Yes. Anything that you want
Oh,
to ask today? Do you have?
yeah.
Okay, what is it?
Yeah, actually, I don't think about that.
Oh,
Yeah.
maybe later you can ask me a lot of questions, okay?
Just right. I will.
Okay. Because it's our first time and I can see your book here. It's in your
Yeah.
articles.
Yeah.
Do you normally study your book and did you choose one for today?
Just right. I normally choose the article first and then read the article and then go to the vocabulary and then comprehension question.
Okay, sure. What is the article for today?
For today's article, I'd like to discuss the number 1199.
Okay, so 1,199. So the
Just
U.S.
right.
formally announced its
Exactly.
withdrawal.
Yep.
Oh my goodness, I didn't know this.
They
Oh,
did.
oh, seriously?
Yes,
Actually, I
right.
deactivated my SNS and I don't watch TV anymore.
Okay, yeah.
Can
Actually,
can you see
President.
this?
Yes. Okay, let me read the article first.
Oh, sure. I
Okay.
will listen. Okay, go.
Okay. The United States has formalized its intent to withdraw from the World Health Organization (WHO) on July 6, 2021.
Mm,
WHO is a United Nations body devoted to coordinating international public health efforts, including the global response to the COVID-19 pandemic. President Donald Trump first said he would withdraw the USA in May if certain conditions were not met within 30 days. The actual project of disent- dissenting, dis-
disentangling,
disentangling the US,
tangling.
yeah,
Mm-hmm.
disentangling, right?
Mm-hmm.
The US from,
Disentangling.
yeah,
Mm-hmm.
disentangling. The US from WHO began, began Monday, July 6th, with a letter signed by Secretary of State Mike Pompeo. Pompeo.
Mm-hmm.
It will take 1 year to go into effect. By law, the US must give WHO a year's notice before withdrawing, according to the New York Times. Public health experts, as well as Republicans and Democrats in Congress, denounces the move. Joe Biden, the Democratic nominee, said that if elected president, he would reverse the decision before it takes effect. In a statement, Elizabeth Cossett, president of the
Mm-hmm.
United Nations Foundation, a private organization that promotes UN interests, called the move. She was cited unnecessary and unequitably dangerous. WHO is the only body capable of leading and coordinating the global response to COVID-19. Terminating the US relationship would undermine the global efforts to beat this virus, putting all of us at risk. The
Mm-hmm.
US already has more confirmed cases of COVID-19 than any country in the world, and as cases continue to surge in hotspots at home and abroad. It's painfully clear that this pandemic is far from over, Cosen said. It's never been more urgent to ensure WHO has the support and resources it needs to continue its life-saving work. WHO has faced some criticism for its response to the pandemic and agreed to an independent review of its decisions and policies. STAT news reported Trump had specifically criticized WHO for not proposing inspectors on China only early in the crisis, but WHO does not have that power. He also criticized WHO for praising China's response during a period when he was also praising China's
Praising.
response. Yeah,
Mm-hmm.
praising. Yes, right. The Trump administration, which has faced sharp criticism for its decisions, messaging, and policies on COVID-19, as the U.S. endures the worst outbreaks in the world, has largely blamed WHO, China, and democratic governance. The U.S. is the largest funder of WHO, according to STAT, responsible for $426 million a year in the
Mm-hmm.
2018 to 2019 budget period, or about $1.30 for every resident of the U.S. The United States is behind on its dues, though owing $203 million in back payments. STAT also reported some confusion from UN officials as to exactly what the withdrawal means in practice for US support and involvement with the organization. That's all.
Oh my goodness. Okay, so tell me, Mr. Tay first, what can you say about this article? So do you think this is really a
Yeah.
good news for US, or what do you think Trump is thinking?
Yeah, actually, I
Yes.
think Trump decided to withdraw from the WHO on purpose
Mm-hmm.
of a political strategy. Actually, he want
Mm-hmm.
to push on the China and WHO, and
Mm-hmm.
he tried to
Okay.
blame China of the COVID pandemic.
19. That's true.
Yeah,
Yes, and this is actually this is one of his reasons why he wanted to withdraw. But do you think this is really effective? Yeah, WHO is really World Health Organization. But this is
yeah,
to protect not only the countries that are in that what's that in organization, but
yeah.
also yeah, they are controlling. So do you think
Yes,
this is a
right.
good news?
Actually,
What
that's
can you
not a
say?
good news, but I
Mm-hmm.
think it's just political action. So maybe after the presidential election in America in November, Trump might cancel his uh, announcing on that
Mm-hmm.
because it's also, as the article mentioned, it's also high
Mm.
risk for the American people
Oh,
to
yes, of
yes, right,
course.
withdraw
Right?
from the WHO. yeah, we need
Oh,
international cooperation to recover and yeah cover the yeah COVID-19 pandemic.
yes, 100% sure. Not your actually what's it? Your local health institution
Yeah,
is
yeah,
not enough unless the World Health Organization will help one country.
yes,
But you
right,
know, Trump
exactly.
just
Yeah,
wanted them to be powerful. But these days,
yeah,
America has, they are the highest
that's
number of
right.
people who got
Yeah, actually,
infected.
yeah, daily coronavirus new patients in America is outnumbered 70,000 people a day.
Oh,
Yeah.
seriously?
So yeah, that's a really serious situation. That means
Uh-huh.
if you
That's true.
calculate that as a month, it means it's almost 200, 2 million
Million.
people
Yes.
uh, got coronavirus, and then yeah, then at the moment maybe um, there is no vaccine or no cure at the moment, so that cause
Mm-hmm.
lots of people die.
Okay. Oh my, it's really serious there, but Trump still thinking about his political concerns. He
Yeah,
doesn't even think of the welfare. You know, in America, if you don't have the insurance, of course, they will never treat you. That's why the rate of deaths or the
yeah,
number of deaths, it's
that's
really
right.
increasing,
Yeah,
skyrocketing,
yeah. Actually, in
right?
Korea, the hospital fee for to cure the coronavirus, it takes only the government charges to the patient only $50, but in America
Mm-hmm.
you
That's
have to
true.
pay
Mm-hmm.
thousands dollars for that.
Oh my. And yeah, I have a student who his friend is in New York, and
Yeah.
he said they should never go out because what's it, hospitals will not assist you if you don't have any insurance or money to pay that hospital.
Yes,
So
right.
imagine, and Trump is going to withdraw? No, I think no. I hope it will be canceled. The
Yeah,
people, the
but
Americans will be. Hmm.
yeah, if you see that Trump, he's just still insisting there is no need to wear the mask in
That's
public.
true.
Yeah, and not only for Trump and also Trump supporters, they also insist. And then if you see someone who wear the mask on the street, then you got
Hmm.
attacked by the Caucasian or Trump supporters.
What? Seriously? It's happening in
Yes,
America now?
yes, right. Especially for Asians, because they think all the Asians look Chinese.
Hmm.
So and also if you wear the mask, then they think the person or the one uh, is considered as a corona patient and also Chinese.
Oh my. That's ridiculous.
Yes, right. You can
Yeah.
see the
That's the
lots of
reason why
news.
they are outnumbered,
Yes,
right?
right. Especially for Korean,
Uh-huh.
we we are similar to Chinese.
Hmm.
So Caucasian, I mean people who live in US or Europe, they think Korean is Chinese. So we have several news who got attacked by the anonymous people on the street.
Oh my, really? That's so sad.
Yeah,
Racism is on the rise these days because
yes,
of
right.
what is happening in the world, right?
Yes, right.
Okay. I hope that, those Koreans who are there, I hope they are very safe because, of course, we all know that we want to go to America, but
Yeah,
we should never, we should
yeah,
never discriminate or, yeah, we may look like Chinese, but that doesn't mean that we are the virus, right?
Right, right.
Okay. So thank you for letting me know this one. Honestly, I turned off all my social media account because I'm sick and tired of the news, even here in the
Yes, right.
Philippines.
Yeah, there
Yeah.
are too many news about the COVID-19, and then all the news is not good for mental health.
Hmm. Okay. So, oh my, this is
Okay,
really,
yeah,
yeah. Let's move on then, right?
okay.
Yes.
So, yeah, time is almost up.
Oh yeah, yeah. But
Yeah.
again, thank you for sharing this one. It was really informational for me. I really appreciate it.
Thank you very
Okay.
much. It's a really good time
Yes.
with you.
See you, Mr. K. Happy
Okay,
weekend.
bye bye.
Bye.